Disappointed fans following music legend Billy Joel's recent diagnosis of normal pressure hydrocephalus, forcing him to cancel all upcoming concerts. Well, here to share more on this little-known brain condition that can mimic signs of dementia is Dr. Lydia Yamada, Assistant Professor of Neurology and Adult Neurology Residency Program Director at MUSC. Thank you so much for being here.
Thank you for having me today.
The brain is a fascinating place, isn't it?
I am completely biased, of course.
Yeah, sure.
I think it's the most fascinating part of the body.
And what I find so interesting, though, is his particular diagnosis, normal pressure hydrocephalus. It's something that doesn't rattle off the tongue very easily. You don't hear it all that often. How common is it?
It's actually not very common. We call it NPH to make it easier for everyone to say, but it's actually not very common. We believe about a third of the population, for example, will have Alzheimer's when they're older than 85. NPH is probably around 5% of that population, so it's definitely not as common as the other types of dementia that we see.
Right, and so that can sometimes be a little confusing whether to diagnose it as such or dementia. So what would be some of the hallmark symptoms that differentiate the two?
Absolutely. So both conditions, I would say, can affect your memory. Especially on NPH, a lot of times we see difficulty first with doing tasks. Remember how to do a task that you would know previously. Gait impairment, so walking, feeling like your feet are glued to the ground is something that's commonly described in NPH, but it can present in different flavors. Yeah. And holding urine, those are the three features that are the classic triad of NPH.
Right, right.
But Alzheimer's, for example, can also present with that. So we have to look at the images to see if there's buildup of fluid, look at how the symptoms developed, and that's when we start putting the puzzle together. But it's not a straightforward diagnosis for sure.
And we talk about hydrocephalus. We're talking about water on the brain. Is that what that means?
That's perfect.
Okay.
Yes.
Okay.
Yes.
So what causes that buildup? Is this hereditary? Is this?
No, we don't really. So most commonly, people will have what we call idiopathic or primary NPH, which it only means that we don't know what causes it. So we don't really know what are the risk factors other than advanced age. Yeah. But it is the fluid building up in the brain. We all have the fluid that we need, especially in the center, these chambers that we call the ventricles, and the fluid starts building up and presses on the brain around it. Oh. And since it's a slow process, the pressure doesn't really go up, but the brain cells don't like that. And then we start having symptoms.
Interesting. And this tends to affect people later in life?
Yes, usually above 65, the vast majority of
So
people.
he's really kind of the prime candidate, if you will, for something like this?
Correct.
And treatment is going to be quite different between this particular diagnosis and, say, dementia?
Absolutely.
Okay, but it is treatable?
It is treatable. I wouldn't say it's curable.
Okay.
But it is for the patients that we really think, they do have NPH. There are tests that we'll bring them to the hospital to mimic the permanent treatment, which is a shunt. So you put a catheter from the brain to the belly to drain the fluid and decrease that accumulation of fluid. So we mimic that when they come to the hospital, see if they get better, and then we pursue surgery afterwards, which you shouldn't do with Alzheimer's, Parkinson's, other types of dementia.
Indeed. So when we're talking about someone like Billy Joel, who has spent most of his life on stage and performing, is this something that he's essentially going to have to quit indefinitely, or do you foresee someone in his condition ever coming back?
Well, without seeing and examining, and
Indeed.
It is hard to tell. People who do have NPH and respond well to that treatment usually gives them at least some time of significant improvement in their symptoms. But a conversation I always have with patients and their families is that it is not a cure forever, and patients tend to start having the symptoms again. We don't know why, despite the shunt, which means that realistic expectations need to be set up when they come to see us and when we talk about surgery.
Having this be so sort of out of left field and not really hearing about it, we hear so much about dementia, Alzheimer's, and so many other diseases that affect cancers and things like that. But MUSC actually has a dedicated clinic
That's
to
correct.
this. So, and pH. So why is that? How did MUSC become a source for
So we started noticing in our general neurology clinic and even on the inpatient side that a lot of times people would come to us either having been diagnosed with NPH when they didn't have NPH, or having that diagnosis missed earlier on, so sometimes even too late to do something about it. So we wanted to improve access and make sure we would have like this team that knows how to identify this disease and hopefully treat people in a more accurate way, I would say.
That was good forethought on MUSC's part, absolutely. And with you at the helm there, thank you so much, Dr. Yamada, for sharing with us.
Thank you so
and
much
helping
for having me.
Educate us on this really interesting diagnosis, and we wish Billy Joel Godspeed. Thank you so much.
Thank you, my
Appreciate it.
pleasure.
We're back in 2 minutes.